everyone, and welcome to Standard Precautions and Beyond, Conversations in Infection Prevention and Control, a podcast of the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or the ARC IPC. Today we'll be discussing syphilis and congenital syphilis, sexually transmitted and congenital infections that continue to have a profound impact on Alabama. My name is Tessa Graham, and today joining us is Dr. Jodie Dionne. Dr. Dionne is an associate professor of medicine and a clinician investigator at UAB in infectious diseases. Her research is focused on designing clinical trials to treat and prevent syphilis, hepatitis B, and other infections in pregnancy in the U.S. and in Africa. Thank you for joining us, Dr. Dionne.
Happy to be here, Tessa.
So we can get right into it. Would you mind providing us an overview of what syphilis and congenital syphilis are and why they're pressing concerns in Alabama?
Sure, I'd be happy to. So syphilis is a bacterial infection that's passed from person to person. And unfortunately, it's one of the pathogens that's the easiest passed through the placenta during pregnancy.
Oh, okay.
So if a woman gets syphilis while she's pregnant or has syphilis before she's pregnant that's not treated, the fetus that can be infected and involved, and it can lead to very devastating outcomes like stillbirth, congenital syphilis in the baby, and long-term health impacts for the child as it grows.
Oh, wow. So what is the current status of syphilis and congenital syphilis cases in Alabama? Are there any trends or patterns that stand out currently?
Yeah, I think unfortunately it's good timing that you're covering this topic now because we are seeing such an increase worldwide in our state and regionally in the congenital syphilis cases. To give you a sense, in Alabama, if you look around 2005 or 6, there was only 1 to 2 cases a year. And then in 2015, the cases started to increase 5, 6, 7, 8.
Oh, wow.
And now in 2022, there were 42 cases.
Oh, wow. So it's been a steady increase.
Exactly. A 600% increase between 2018 and 2023.
Not a rate we want to see for something like this at all.
Exactly.
So what are some of the factors that contribute to these high rates of syphilis and congenital syphilis in Alabama? And are there any specific, social, economic, or healthcare-related challenges that are affecting these rates?
I think the really important message to get out first is this is a preventable problem. If we test for syphilis in pregnancy, we can diagnose this infection early, we can treat the moms, and we can prevent this from happening. Exactly. The problem with syphilis is that I think unlike common knowledge, it's usually asymptomatic. So somebody who has the infection doesn't feel any different than somebody who does.
Oh,
so
wow.
the onus is then on the doctors and the healthcare providers managing pregnant women to be sure that we look for it. In Alabama, there were about 1 in 4 women who had congenital syphilis who hadn't had prenatal care at all.
Oh, wow.
But of the women who did have prenatal care, many of them were screened for syphilis in early pregnancy. That test was negative, and then they went on to acquire syphilis sometime during those 40 weeks, and the testing wasn't repeated in time. So that's one of the messages to get out there about this.
Yeah, so test often and early and treat it when you can.
Exactly. And it is treatable with penicillin, which is readily available for the most part in all of our communities.
Pretty standard treatment case there.
Correct.
Awesome. So what communities or demographics, speaking of those 1 in 4 women, are there any communities that are more disproportionately affected by syphilis and congenital syphilis? And how does that affect the overall health of these communities, or what does it speak to the overall health of those communities?
Yeah, I mean, I think that the number one thing to know is obviously congenital syphilis in the infants is tracking syphilis in women. And the rate of syphilis in men is increasing, but the rate of syphilis in women is increasing too. When you look at who's getting syphilis, it's predominantly women of reproductive age between the ages of 15 and 34. So in a way, it's not surprising this is happening to women at the same time that they're in their years where they're more likely to be pregnant and to get pregnant. I think it's important to say that although we used to have kind of pockets of congenital syphilis in the country, now it's seen in almost every state, most counties.
Oh, wow.
It's something that I think all providers should be comfortable recognizing and testing for and treating. It's not something that just happens somewhere else. And clearly in Alabama, it's happening all over the state.
More common maybe than they realize. Even.
Exactly. But if you look at particular groups, it is more common in Black women compared to white women. It's more common in women who have Medicaid insurance versus private insurance. Those are some of the trends that we see.
Yeah, some of those kind of historical trends in Alabama for things like this.
Right, and probably related to things like access to care and other systemic issues that get in the way of having good prenatal care provided.
Right, yeah. Another issue that we'll have to touch on another time.
Correct.
So of these barriers, then, how do you think that we can overcome those barriers? Is it an education issue? Is it increasing that access to care? Or what are your thoughts in that area?
I think it's definitely both those things. I think on the public level, we want the public to know this is still a problem. It hasn't disappeared and it's going in the wrong direction. So it's okay to advocate for yourself and say, did you test me for all the tests I need during pregnancy? Even if you had it at your first visit, you should have it again at 28 weeks and then at the time of labor and delivery, just to be sure it hasn't happened. And on the provider level, making sure that you have systems in place to ensure that at your clinic or in your hospital, you're testing women not just at the beginning of pregnancy, but for a second and a third time, just so you catch it. Because once the infection has already passed and the devastating consequences have happened, it's treatable, but usually you can't prevent all the adverse outcomes the way you can with an early testing and treatment.
Kind of lingering symptoms, things like that. So what role do you think schools, communities, healthcare providers could play in raising awareness?
I think making sure this is a topic that's discussed when people do come together to talk to the community. When we talk about HIV testing in pregnancy, we can often put testing for syphilis along with that and other infectious diseases, so we can do more than one thing at a time. I think making sure that the providers are aware of what syphilis looks like in pregnancy and in the newborns. Most of the time, these babies are totally asymptomatic as well, so you have to maintain a level of suspicion as a pediatrician and knowing what the mom's history was, which isn't always something the pediatrician's aware of. So part of it is all the things that we do in perinatal health to make sure that there's crosstalk between these different provider teams. And then the piece about women not accessing prenatal care is another really big part of this. We talked about 1 in 4 women not having any prenatal care. So that goes with a bigger message and making sure when you're pregnant that you're getting into the doctor to get your blood pressure checked and to get all the testing that you need.
Sometimes seeing them regularly.
Exactly. Sometimes women, I think if they're on their second or third pregnancy, may feel like they sort of know what to do, but it's important for every woman to get prenatal care early to pick up things that can be prevented.
Yeah, absolutely. Especially if one thing we haven't touched on yet are other risk factors. Can you touch on those as well so those people know to be more aware?
Yeah, I think the trouble with syphilis is it's usually acquired sexually from a partner. So some women would be aware that they could potentially be exposed, but other women have no idea that they could potentially be exposed. So that's kind of what makes it tricky. We know that women who use drugs or use other substances are more likely to have syphilis. So that's a group that we want to make sure particularly gets screened at a frequent rate.
Yeah, so that screening and staying aware is what I'm hearing for sure.
Yeah, exactly.
So what other initiatives or strategies are in place to prevent congenital syphilis and address the syphilis rates in the state? And how effective have these been so far?
Yeah, so I can't really speak to the effectiveness yet. I can say that every provider and really every woman who hears about this is alarmed by the trend. So the Alabama Department of Public Health has done a lot to work on messaging, to send out these things like these health alert networks to all providers to make us aware of the trend, and to facilitate access. So what they've guaranteed is free testing and treatment for all pregnant women in Alabama. If cost is a barrier, let it not be a barrier. So that's part of their messaging. The other piece of this, as you can imagine, when a woman has syphilis, what you want to do is treat her partner so she doesn't get reinfected after she's been treated. So the other part that they're setting up more concretely is a real system for partner treatment, so that reinfection doesn't happen. So that's an important piece. How well it's working, I think we'll have to measure in the future.
Absolutely.
But everyone keeps hoping year after year these rates will start to come down.
Yeah, hopefully so. So what other steps do you think we can take in Alabama to help reduce those rates of syphilis and congenital syphilis? What can individuals do other than getting tested, that awareness, being careful? And are there any resources you would recommend for people who want to learn more about this or help with these awareness and prevention efforts?
Yeah, so I can't help with my researcher hat on to say a lot of these things we can answer through research. So that would be better tests that diagnose syphilis in every baby quickly and every pregnant woman quickly and accurately, more treatment options so that if there is a shortage of penicillin, we have other treatment options that we can use with proven efficacy and safety. And then ways to improve our systems to ensure that the access to care is close to 100%, to ensure that the second and third trimester screening happens universally. There's lots of things we can and should improve and lots of places to focus. So if you're a health policy researcher or a researcher out there, this is definitely a place to focus our attention to turn these rates around.
Yeah, absolutely. So there's a lot of work to be done.
There is. And that doesn't even reach your part of the question about what the public should do and what women should do. I think women should be aware and should ask about this, and awareness is the biggest component right now.
Absolutely. Well, hopefully we've brought some more awareness to it here. And thank you so much for joining us, Dr. Dionne, and sharing your expertise with us. I know I learned a lot about congenital syphilis and syphilis. So hopefully our viewers feel the same. And thank you, everyone, for listening. So please tune in next time for another episode of Standard Precautions and Beyond, Conversations in Infection Prevention and Control.